So we're going to talk about canine copper hepatotoxicosis. Do you guys know what's that?
I know canine is dog. That's all.
Canine is dog.
Hepa, so it should be something to do with the liver.
Yeah.
And
So toxicosis is
toxic.
resulting in the toxic over accumulation of copper in this case.
Okay.
So our learning objective for today is we're going to talk about the cause and symptom of it and explain some of the biochemical processes and to know the prognosis of this disease. So some of the veterinary terminology which you guys should never heard about it and you should know about it. One is polydipsia, which is increased level of thirst in dogs. So repeat with me, polydipsia.
Polydipsia.
Okay. Polyuria?
Polyuria.
Increase in urine production.
Abnormally high urine production.
For animals.
For dog, animals. And hepatic encephalopathy, which is the nervous system dysfunction.
Hepatic encephalopathy.
Hepatic encephalopathy.
Sound like hepatic cell phone tip.
Yes, that's right.
Yeah. Hepatic is because it's something to do with the liver, and encephalopathy is cephal. You know, cephal is head, brain, right? So it's like brain has something to do with nervous system. And it's the nervous system dysfunction due to the liver being unable to break down ammonia in the body. And the other one is hepatic necrosis, death of liver cells.
Oh wow.
Melena, which is the passage of black terrace tooth composed of largely blood. And ascites. Ascites is spelled as ASCITES, ascites. And it's the cause of abdominal distension due to fluid accumulation in the abdomen.
Of the animal.
Yeah.
So
You can start with the symptoms of it.
Yes. We have the symptoms of canine copper hepatotoxicosis. There are two. I will present about there are two acute and chronic symptoms. Means acute like the
Which part?
no, not part because the
Really?
the regular one, regular yeah, something like that. And the chronic is like severe.
Yeah.
I think. Okay. Okay. For the acute symptom, basically, we can see it from the dog itself because sometimes the symptom basically the dog will vomit. The dog become lethargy and the dog has depression, and I think the more that we can see is in the eyes because the eyes is yellow in color because it's due to jaundice. So for the chronic symptom we have anorexia, depression, weight loss, but basically because when we talk about liver dysfunctionality, even in human, we will relate it to jaundice.
Yeah.
Jaundice is because we can distinguish someone with jaundice or not is by his or her eyes because the yellow one, because the yellow color is actually actually from bilirubin, which is some kind of part of is a yellow pigment that that will appear when jaundice happen to someone.
So it's due to the yellow pigment produced by the
that bilirubin, pigment. But basically, the dog is become very thin. Because there's the severe symptoms.
Okay. So After symptoms, then we should proceed
Root
to
of disease.
disease. Yeah.
Diseases.
Yeah. So some of the roots of diseases is the trauma, which is we can get it when the dog is like being what you call that, in a car accident and hit on his
Liver.
front abdomen. Yeah. So they can get trauma, which cause to have the hepatotoxicosis. That's because of the liver lobe fracture and it bleed into the abdomen, which can lead to death.
Oh.
And pancreatitis, which is severe inflammatory process which the digestive enzyme they spill into the liver. Yeah, and then it can result into some kind of hepatitis because of the close proximity of the pancreas to the liver and the bile duct.
Okay.
And it can cause anemia too. It can cause anemia pula. Okay. The cause would be the anemia.
Oh.
Yeah. Anemia is the
Can I sleep? No.
no. That's the reduction in blood in the production of blood.
This is infectious hepatitis, typically caused by the adenovirus or herpes virus, transfers from dog to dog by oral contact and injection. Usually only causes a transient, non-specific illness characterized by lethargy, vomiting, diarrhea, and fever. Sometimes develop into a full-blown case of severe hepatitis with many of the symptoms previously noted. Treatment is geared to support while the body fights off the bug. Prevention is by vaccination. Bacteria, virus, and fungi all can cause liver disease. And since bacterial infection is common in many liver problems, it is routine to use antibiotic when treating liver problems. Specific disease include infections, canine hepatitis, canine herpes virus, leptospirosis, abscesses, hepatoplasmosis, coccidioidomycosis, and toxoplasmosis.
Oh, so
That-
complex. Very good. Your pronunciation.
Leptospirosis is bacterial infection common in wildlife and transferable to domestic animals and human people through contaminated water. Dangerous, possible fatal, but the vaccine is quite good for prevention. Certain parasite will infect the liver.
Okay. Next disease is chronic hepatitis, which is primarily found in Badminton Terriers, Doberman Pinschers, and West Highland White Terriers.
That is breed dog breed, right?
Yeah, one of the kind is
Yeah.
breed of dog. Dog breed.
These are all genetically inherited diseases which cause abnormal and toxic level of copper to be stored in liver. And the cause of the disease is variable. However, the diagnosis is based on liver biopsy. The treatments require to use of copper binding drugs, inflammatory, to decrease liver inflammation, dietary modification to limit the copper uptake. And next is hepatoportal fibrosis.
Oh.
Yes. It is a disease which is primarily of the blood supply to the liver. Ways to diagnose it by very specialized radiograph techniques which measures and visualize the blood flow through the liver. Biopsy critical for the diagnosing location of the lesion.
Okay, next, we'll continue about the roots of the disease. It is heartworms, the worms in the heart of the animals. This worm can block the blood flow into the liver and can cause liver failure. This so any disease that can cause failure of the right side of the heart can also cause liver problems. Next is toxin. The primary disease is caused by injection or inhalation of a toxic substance which adversely affects the liver. This is because liver is where the toxification of chemicals occurs.
Yeah.
So the factors contributing to the disease are gender. Females are more susceptible. Continuous and high levels of exposure to toxin. This will cause death and inflammation of the liver cells, followed by replacement of damaged tissue. Toxins include many common drugs, such as anabolic steroids, antibiotics, anesthetics, etc. Some of the drug will induce hepatitis, which is a predictable side effect of the drug, while other incidents of hepatitis are considered an unpredictable or abnormal side effect of the drug. This is actually difficult to diagnose unless there is a known exposure to the drug or toxin and the appropriate tests are taken. So,
So can I ask, actually the breed, the Paddington Terriers, Doberman Pincers, and West Highland White Terriers dog. Actually, this is the breed that usually common canine copper hepatotoxicosis, right?
Yeah.
But how about the crossbreed between? I just keep asking. But the next, the next disease is glucocorticoid hepatopathy. The dog seems abnormally sensitive to glucocorticoid drugs, which is cortisone, the usual name. Okay, and will develop typical lesions in the liver after multiple dose therapy or long-term overproduction of intrinsic cortisone by the adrenal gland, Cushing's disease. So I think we should search more about the Cushing disease, because I don't know what I'm talking about. Lesions are fairly typical, and the rare animal which shows liver-associated symptoms during glucocorticoid therapy will improve with the removal of the steroids. Liver-associated lesions may take weeks to months to heal. So next disease is anticonvulsant associated hepatopathy. Phenobarbital, primidone, phantom may cause liver disease.
Oh, wow. The language you are talking about.
6 to 15% of all dogs
Yeah.
on anticonvulsant therapy. Yeah. Inflammation seems related to dose. Degree of disease is variable and unpredictable. Diagnosed based on history, symptoms, laboratory tests, and vaccine. Basically these two diseases I'm explaining about is related to the breed of the dogs, okay?
Yeah.
So there are literally thousands of chemicals that could be toxic to the liver. A few examples of these chemicals that are commonly used to treat ill animals include, first of all, Rimadyl,
What's
which
that?
is arthritis treatment. You know arthritis treatment?
Means the Rimada is the disease or the treatment?
The disease. So we use the
Arthritis
arthritis
treatment.
treatment for treat this disease. Okay.
Oh.
So next is thiacetarosamide. It is heartworm treatment.
Just pronounce it better.
Thiacetarosamide.
Oh, okay.
Okay.
Alright.
So next ketoconazole.
Why does it sound like an African language?
Maybe the person who invite this treatment is from the African.
Yeah.
It's a fungal treatment. Okay.
Okay.
Next is Tylenol, acetaminophen, and glucocorticoids. Cortisone.
What the?
Glucocorticoid.
Okay, I proceed about the anthelmintics, worming medication, parasiticides, phenobarbital, epilepsy medication, and next portal vascular.
And for the portal vascular abnormalities, right, it usually occur when the portals immediately shut allow the blood to pass from the digestive tract directly to the general circulation without being detoxified by the liver first.
Yeah.
Usually a congenital defect registered to the young dogs and puppies, but can be the result of hepatic cirrhosis. Systems are never consistent, but many dogs are young, malnourished, chronically sick, poorly tolerant of toxic drugs and anesthetics, and tending to eat strange items like pica.
What is pica?
I don't think but not the pizza, it's pica. So for the diagnosis for this disease is based on the physical exam, historic, laboratory tests, and specialized X-ray showing blood flow through the liver. Treatment is surgical correction of the circulatory abnormality to force the blood into the liver prior to it enter the general circulation. So beside it, it also got the disease of cirrhosis.
Yeah.
Cirrhosis or cirrhosis?
I think cirrhosis.
Cirrhosis.
Yeah. So actually,
it's cirrhosis.
cirrhosis. Okay, cirrhosis is the liver disease also, but this is the end result of several liver disease. And about this disease, it's very hard to find the information about the cirrhosis because it's like different type of the end result of different type of liver. So it's like a combination of many type of liver disease. So very hard to like identify what is it actually. So cirrhosis can occur in the copper storage disease of the liver as the end result of the idiopathic chronic hepatitis. So it's also called chronic active hepatitis.
Yeah.
Okay, and also it's called like chronic canine inflammatory hepatic disease, or there's some probably got other names lah. So this one the cirrhosis I mentioned just now, it can occur in the copper storage disease, right? So it also can be as a breed-related disorder. So the breed-related disorder is like a several terroid breed like Dobermans, Labs, Cockers, and Standard Poodle. So this is due to the anti-seizure medication and possibly due to the caprofen and the oxybenzone dewormer. Okay, don't know what is that. You just know it's a dewormer. So it sometimes is the end result of the infection, illness, especially leptospirosis and the infections canine hepatitis. So but this one is pretty rare now lah, because now our medication is quite advanced.
Yeah.
So of this condition, the one usually show up without much warning is the idiopathic chronic hepatitis, and this condition can sometimes go on for a longer period of time, which no really obvious clinic signal, and can affect the patient, which the canine may have the markedly decreases liver size and the function when the condition finally cause clinical signal, which means that we are very hard to detect whether the dog got this signal or not. It must wait until like final stage or late stage, then only the clinical signal show up. So this time we can detect it and diagnose it. So even at this point, it's often possible to help the patient feel better for some time, because it's like really late, right? So you have to make good for the dog lah. So there are some methods for it. The usually recommended one is to use a low or moderate protein diet to try to decrease the liver workload. Maybe you can use the metronidazole or the neomycin orally if they are a sign of the central nervous system disturbance. Or you can give the lactulose for the same reason. Or you can...
Is that enzyme?
To lose. I don't think so, because enzyme is the behind is like a substrate, I think. So okay, if you can use the crochin, whatever, crochin or the usodiol, or sometimes the copper chelating agent if there is necessary, and this one is to provide the general supportive care such as the gastrointestinal protect if the GI ulceration occur, and you can give the fluid therapy if there is a dehydration, and you give vitamin K if the blood clotting problem occur, possibly vitamin E as the antioxidants. So in the liver disease, at least if the copper toxicosis is possible, it's the best to avoid vitamin C supplementation, as it can make the copper toxicity worse. So if you found that your dog got this type of problem, don't feed him the vitamin C supplement.
I think we also could consider the use of SA-amidinosyl SD4RX.
Yeah, that one if to provide a general supportive care.
I would like to add on of one Chang just now. As the DJ mentioned above the progress, they will slowly destroy the liver cell, resulting in scarring and increase the fibrosis in the liver or cirrhosis. Some patients live for extended period of time even after it is clear that they have reached the stage that the liver cirrhosis is occurring. It can be pretty hard to go back at the time there is cirrhosis and to figure out what is occurred. So when the liver disease is discovered at these stages, it may not be possible to give you information on the underlying disease, and thus the diagnosis of cirrhosis rather than a more specific diagnosis.
I see.
So now we're all talking about the disease. So what is the biochemical
I want to know
process?
about the biochemical process.
Oh, well, okay. So in order to kind of when the first indicators of major hepatocyte damage in the liver will be an increase in alanine aminotransferase or ALT, and you'll also notice a decrease in serum albumin. But when this disease continues to advance and it comes into a really advanced stage, you will notice a more pronounced decrease in albumin, and also you will notice a more pronounced increase in the alanine aminotransferase, alkaline phosphatase, bile acids, and ammonia. So these increases in the serum alanine aminotransferase activity are considered liver specific in dogs. That means you only notice it in the liver of dogs. So the magnitude of the ALT serum is roughly proportional to the number of injured hepatocytes. So with that, we can kind of gauge how advanced the disease is.
So an alanine aminotransferase ALT test measure the amount of this enzyme in the blood. ALT is found mainly in the liver, but also in small amounts in kidneys, heart, muscles, and pancreas. ALT was formerly called a serum glutamic pyruvic transaminase (SGPT). ALT is measured to see if the liver is damaged or diseased. Low levels of ALT are normally found in the blood, but when the liver is damaged or diseased, it releases ALT into the bloodstream, which make ALT levels go up. The ALT test is often done along with other tests that check for liver damage, including aspartate aminotransferase (AST), alkaline phosphatase, lactic dehydrogenase (LDH) and bilirubin. Both ALT and AST levels are reliable tests for the liver damage. So the prognosis.
I found out that since this disease is basically a genetic disease, so often treatment is not successful, and the prognosis is poor in all species because this disease doesn't just happen in canine but also in sheep. But in canine, what people do nowadays is that they give gastrointestinal sedatives and symptomatic treatment for shock may be useful in acute toxicity, which is the early stage, not the one chronic like what KHALIESAH said. So if it's not too late, it is still possible to treat it with penicillamine or calcium versenate to enhance copper secretion. Vitamin C has been shown to reduce oxidative damage to red blood cells during hemolytic crisis. Ammonium tetrathiomolybdate also is effective for the treatment in prevention of copper poisoning. This treatment reduces copper absorption and enhance copper elimination from the dog. Should be used conservatively, and withdrawal period of 10 days is required for this medication. Should be used conservatively with daily oral administration of ammonium molybdate and sodium thiosulfate for 3 weeks reduces loss in affected animal. Dietary supplementation with zinc acetate is also useful to reduce absorption of copper and in periodic liver biopsies, tissue copper determination and liver enzyme assessment is also useful to evaluate the disease status to know the current what happened to the dogs. In addition to previously described treatment, zinc supplementation and prednisone or prednisolone administration enhance copper excretion and limit development in liver disease.
Okay, so instead of giving them medication, we can also use another way, which is we control the dog's diet. Basically dog with copper associated hepatotoxicosis, we can avoid them from giving soft water which from copper pipes, and we also need to avoid them to eat stuff like shellfish, liver, kidney, heart, nuts, so that because the food that I mentioned is actually contain copper, so we want to reduce it, so we must control the diet. So and then for growth and maintenance dog foods, based on Association of American Feed Control Officials, and they said that they recommend 73 to 250 ppm dry matter basis of copper for dog. And for therapeutic veterinary diets, they said that for patients with dog, basically with liver dysfunction 3 to 5 dmb of copper, but basically we don't have time to to measure, and we basically give kibbles only for the dogs.
So copper canine hepatotoxicosis, what we've covered so far is that it occurs due to genetic abnormality, right? Of a specific gene function. So how to treat this? We could practice a copper restricted diet like what you said, and also give it water soluble vitamins. So I think that covers it.
This disease is mainly because of gene gene of the breed dogs. Alright, thank you. Okay.
Thank you.